gynaecologist Dr Yuvraj Jadeja, who joins me from the state of Gujarat. And he is seeing how the virus is now affecting pregnant women and even claiming unborn lives. Welcome to the programme. Tell us, Doctor, what you're seeing.
So unfortunately, with the rise of patients, pregnant women which were in the last wave, somehow not being affected this much. We're seeing a lot of pregnant women these days getting the infection. And now we know for sure that pregnant women are at high risk for all complications, including oxygen requirement, hospitalization, and it's very difficult if they go into critical stages. They would require ventilatory support, and the death rates would also be higher in pregnant women. So with the deficiency of beds, having pregnant women not getting bed becomes even worse. And with pregnancy, you're dealing with two lives, not one.
And it's also affecting women who are young mothers-to-be. I believe you had a case of a 24-year-old mother.
Yeah, so unfortunately, the 24-year-old, she was 32 weeks pregnant. We were given a call that she was not getting a bed and she required urgent hospitalization and oxygenation. So we kind of arranged, but she was at a distance from us. And unfortunately, even with the oxygen support, while she was being transferred, midway, she had an episode of severe hypoxia. So she was diverted to another city which was nearby. But unfortunately, we couldn't save the mother and the child.
It's very sad indeed. And Doctor, is this something that you're seeing now in recent weeks, in recent months, compared to, let's say, the first wave?
So yeah, I think the numbers are something that have become very overwhelming in terms of management, and that's the problem. But I guess again, steps are being taken. There's no point to blaming the government, because I think the cases are so high that there's just no space. In fact, now the government has recently passed a law wherein, any private hospital, not only government-run hospitals or as a matter of fact, any hospital is allowed to take and treat COVID patients in dire emergencies. So that's the best anyone can do. I think the only way it can be stopped is, if people and all of us start taking care and get into our own isolation and start maintaining all the rules that we've been talking for 1 year.
And we spoke previously in the program about a lot of Indian people posting online asking for help. Surely there are risks associated here?
I would rather say that, we need to compare the risk-benefit here, and I think the benefit is much more, because I myself am active on social media and I'm trying as much as possible to dish out information, dish out awareness, whatever is important. And at the same time, I get a lot of DMs where people are not able to approach a doctor, just when they are worried, what should they do? Should they get tested or not? Should they go to a doctor or not? Should they isolate themselves or not? And I think that's where social media comes into picture, and it's as many help as we can. And in fact, there are a lot of case reports where social media has helped people to connect patients to hospitals which have beds, to drugstores which have drugs that they were needing and were in requirement of. So I think social media and social media people are, of course, there is a risk of false information, but I guess at this time, any help is appreciated.
It's good to hear that social media is helping in this situation. Thank you so much for your time and speaking to us. Gynaecologist Dr Yuvraj Jadeja speaking to us from Gujarat. Appreciate it.